Photograph the treatment area. Before starting the treatment, take photos of the area to be treated. Turn on the device and swipe card. Prepare materials before operation. Both the operator and the customer should remove any metal accessories. Wear gloves and disinfect the probes, covered with a disposable facial towel. Wet the towel with purified water to 2/3 of its surface. Heat the cream on the probes. Spreading the cream and manual examination. Spread the cream evenly over the area to be treated while simultaneously examining the health of the breast for any lumps, hyperplasia, or fibrous bands. Conduct a consultation with the client. Does she have any breast diseases? Has she undergone any surgeries? Has she had breast augmentation? Are there any implants present? Breast augmentation and the presence of implants are contraindications for this treatment. Chest adjustment techniques from outside to inside, from bottom to top, avoiding the nipples and areolas. 1. Push upwards along the outer side of the chest 5 times. 2. Push inward along the upper side of the chest 5 times. 3. Push inward along the lower side of the chest 5 times. 4. Push upwards along the inner side of the chest 5 times. 5. Perform a large sweep with both hands from the chest to the arms, pushing out through the fingers to complete the technique. Step 1. Move around. Choose the dredging mode and adjust the level according to the customer's comfort. When performing meridian dredging, remember to apply slow, deep, and steady movements so that the pulsed energy can penetrate into the meridians and bodies. Circular movements on the chest. Introduction script. Explain the role of the chest. Explain the health risks related to poor circulation in this region. Provide a diagnosis and outline how these issues affect the customer. The chest is connected to 6 meridians. Enhancing chest care can strengthen heart and lung function, boost immunity, and improve charm and confidence. Blockages in the chest can lead to severe liver and gallbladder issues and are high-risk areas for breast cancer. Use 2 probes alternately to push and soothe the chest for 30 seconds to relax the chest muscles and fascia for better treatment. Avoid nipples, areolas, and areas with lumps or hyperplasia. 1 probe is positioned under the armpit, and the other performs circular movements on the chest for 3 to 5 repetitions. Vessel conception. Introduction script. Explain the role of the meridians. Explain the health risks related to poor circulation in this region. Provide a diagnosis and outline how these issues affect the customer. The conception vessel is the hub for reproduction, governing all yin blood in the body. Blockages can result in menstrual disorders, vaginal laxity, fatigue, and affecting marital life. Position 1 probe under the armpit and use the other to push along the conception vessel. Asking if there is any pricking sensation, repeat back and forth 3 to 5 times. Clavicle lower edge. Introduction script. Explain the role of the clavicle lower edge. Explain the health risks related to poor circulation in this region. Provide a diagnosis. The clavicle lower edge contains the subclavian muscle and pectoralis major. Tension in these muscles affects lymphatic drainage. Position 1 probe under the armpit and use the other to pull along the lower edge of the clavicle. Feeling the tension in the muscles, repeat back and forth 3 to 5 times. Axillary lymph nodes. Introduction script. Explain the role of the axillary lymph nodes. Explain the health risks related to poor circulation in this region. Provide a diagnosis and outline how these issues affect the customer. Axillary lymph nodes are detoxification channels for the chest, arms, meridians, and shoulders. Blockages can lead to lymph node lumps, breast hyperplasia, accessory breasts, and pain during arm movement. Check for accessory breasts, swellings, and any lumps or fibrous bands. Use 2 probes simultaneously from the armpit to the inner half of the upper arm. Or position 1 probe under the clavicle and use the other to pull along the inner half of the arm to enhance lymphatic drainage. Repeat back and forth 3 to 5 times. Second step, locate. Switch to the stretching mode and adjust the intensity level based on the customer's comfort. Activate the acupoints, Tiangxi plus Tanzhong, Kufang plus Rugen, Kimen, Jiquan plus Yuanye, Jiquan plus Yunmen, Zhongfu. Each acupoint should be held for 30 to 60 seconds. Activate the acupoints. Interact with the customer to assess the flow of energy through these points and provide a diagnostic assessment. Tanzhong, the main switch for human qi flow. Blockage here can cause chest tightness, chest pain, indigestion, anxiety, and depression. Tiangxi, an important point on the spleen meridian, blockage can lead to breast inflammation, intercostal neuralgia, and pneumonia. Kufang, a vital point for chest and lung storage, blockage can cause chest pain, intercostal neuralgia, and fullness in the chest and ribs. Rugen, an important point on the stomach meridian, blockage can lead to breast pain, mastitis, insufficient milk production, and chest pain. Kimen, an important point on the liver meridian, blockage can cause liver stagnation, breast lumps, hyperplasia, menstrual irregularities, and dysmenorrhea. Jiquan, an important point on the heart meridian, blockage can cause heart pain, arm pain, lymphatic congestion, and accessory breast hyperplasia. Yuanye, an important point on the gallbladder meridian, blockage can lead to liver stagnation, headaches, rib pain, swollen armpits, and mastitis. Yunmen, a crucial point for promoting lung qi. If Yunmen is blocked, it can trigger coughing, chest tightness, and shoulder problems. Zhongfu, an important point on the lung meridian, blockage can cause coughing, asthma, and periarthritis of the shoulder. Third step, clear. Switch to the moxibustion mode and adjust the intensity level based on the customer's comfort. Suspensory ligament relaxation and lengthening are the main reasons for breast sagging. Focus on improving the flexibility of the fascia on the upper and outer sides of the chest to reshape the chest shape. Position 1 probe at the suspensory ligament location on the upper side of the chest and the other on the outer side of the chest. Perform fixed point operations for 1 minute, sliding operations for 1 minute, not exceeding 3 minutes in total. Strengthen fixed points for about 1 minute at locations of lumps and fibrous bands cumulative time. Avoid fixed point operations on nodules, cysts, and fibroadenomas. Step 4. Circle. Switch to pure heat mode with 0 intensity. Perform circular motions over the treatment area for 2 to 3 minutes to soothe the muscles. For first-time customers, you can extend this soothing time. Guide the customer to notice the improvements in their body. After the treatment, take photos of the treated areas and compare them with the before photos. Real-life examples of successful treatments. A single device can serve as a performance center for various establishments such as wellness spas, Thai massage parlors, and orthopedic massage clinics.